Okay, hi everyone, welcome back. It's Monday, and yes, our second exam is at the end of this week. So our next lecture, Wednesday, is just a review session. There's the review session FAQ on Top Hat. So again, and also the review guide is already, I uploaded late on Friday, so it's already there on the resources folder in Laulima. And especially if you're worried about the muscle anatomy, I included a list for identification and pictures. I included a list of which figures I think are most high yield, and someone asked a good question, like what about very deep muscles that are very small? I'm going to be very realistic about that, and for the very small muscles, focus on the ones, if it's a very small muscle that's hard to even determine or discriminate even in the Martini version, I will probably ask you more about the actions or information you can get from the muscle name rather than identification, because I think that's more appropriate for like the lab where you can study muscles more in depth, or your future classes as well. But for today, we're going to, if you're just taking the lecture, we're going more for like those big images, because again, there are so many muscles, and I think just knowing all of them would be a big tall order if you're not taking the lab. So again, focus on what's in the study guide. And yeah, so it seems like a lot of you like the Top Hat questions from last time, so let's do a few of those. Okay, and what we have here is, like, for this, it's a click on target question. And this type of question, well, it won't appear on the exam, but the great thing about this is it kind of tells you, like, oh, can I really identify these? But this is for you to test your knowledge. And so Orbicularis Oculi, and hint, there's a location and there's also a shape in the name. So can you, even if you've never actually done the homework or identification of these muscles, can you make a good guess at where it is? Okay. And it seems like most of you clicked this spot over here, and most of you are correct. Yes, that's the Orbicularis Oculi. So again, ocular referring to the eye, Orbicularis referring to that round circular shape of the muscle. Okay, and can you identify the Zygomaticus Major? So all you do is click on the yellow, put your little marker in the yellow box. That's on the Zygomaticus Major. Okay, the most common responses, let's see the heat map. So most of you clicked this one over here, some of you clicked over here, some of you clicked over here. So the correct answer is this one over here. So this is the one that's connected right to that zygomatic bone. This is that big one called the masseter. So that's not the even though it's connected to the zygomatic and temporal bone to a bit, this is the Zygomaticus Major. And the Zygomaticus Minor, someone clicked there, so it's I didn't have it didn't have a yellow box in this image, and it's a common way to get confused. Like the minor and major, you might think, oh, major is maybe it's above something, but the Zygomaticus Minor is actually a little more superior, but it's generally smaller. So that's the Zygomaticus Major over here. And one more click on target. So can you identify the SCM, the Sternocleidomastoid, one of my favorite muscles? Okay. Alright, most of you clicked over here with this muscle over here, and you are correct. So again, this is, even though it has a big, scary sounding name at first, love the Sternocleidomastoid. Not only is it important in your neck movement, but also because it tells you exactly where it is if you know the root words. So you have the sternum, you have your cleido, which is the root word meaning clavicle, and the mastoid process of your temporal bones. So it reaches all the way to that mastoid process. You can feel it in the back of your ear, and this is where you have the sternocleidomastoid connecting to. So all three of those areas. Okay, so back to our lecture. So one thing I alluded to but didn't get time to talk about, or I was able to talk about near the end of the last lecture, are my unofficial rules of the muscular system. And one question I asked, okay, what's the opposite of major? Well, thing is that this is another unofficial rule in terms of naming muscles or skeletal muscles. If part of a muscle name has an opposite term or antonym, typically a muscle exists with that opposite name. So like we mentioned, Zygomaticus Major that we identified earlier, opposite of major is minor, right? So if there's a Zygomaticus Major, there's a Zygomaticus Minor, and there is a Zygomaticus Minor. Now here we have a levator anguli oris, and you might be like, okay, levator, so it sounds like elevator, right? And remember that there's a joint movement called elevation where you raise something up. And anguli sounds like angle, and oris refers to mouth, right? So notice where this, it's actually tucked below and deep to the Zygomaticus Major and Minor here, but notice that it's over here and aligned this way. So what's going to happen when this contracts? Well, it's actually over here, an angle of your mouth. So it's going to elevate and cause you to do that. So if you have your levator anguli oris and just find some way to just contract those two muscles on the either side of your face, it'll elevate the angles of your mouth. So it's one of those quote-unquote smiling muscles. Now, what's the opposite of elevation? Well, elevation and then depression, right? So elevation is going to upturn the angles of your mouth. And then you have the depressor anguli oris. So again, opposite of elevation is depression. That's why it's also a good thing to know your opposite joint movements. So remember that elevation, depression, abduction, adduction, flexion, and extension. You should definitely know opposite movements. And remember that other thing, if there's a muscle that does a movement, there are muscles that undo that same movement. So this is why we have this rule of opposites. It might be like a rule, unofficial rule 2b by making its own rule. And oris and anguli, do they really have opposites? Not exactly. So again, if there's a definite opposite, there's probably a muscle that exists with that opposite term. And let's go back to top hat. So let's see if you can apply this rule. Next question. So based on what you know about joint movements, anatomical directions, and landmarks, hint, labii refers to labia, which is Latin for lips. So what does levator mean? What direction is superior? Can you make a good guess where the levator labii superioris is? So most of you, so it's either people clicked over, let's see, where did people click? People either clicked here or over here. So this is actually the Orbicularis oris on this square here. So this is the correct one over here, up here. So that's the levator labii superioris. So notice that it's superior to the lips. And what's going to happen when it contracts? Well, when this contracts, it's going to shorten things up and it's going to pull the lip upwards. So that's why it's the levator labii superioris. And here's, okay, so this is a question you might see, and it won't appear exactly, but very similar format. So you have an image like this. Identify the muscle highlighted in blue. So this is more typical of a question you might see for the axial and appendicular skeleton or the skeletal muscle chapters of our book. So this muscle here, what is it? Okay, lock in your answers. And this is what people said overall. Most of you said Depressor labii inferioris, and most of you are correct. So this is a great example of that rule of opposites. Remember, we have our levator labii superioris. So this is a depressor. It's going to pull the lip down. It's going to pull that lip, and it's also inferior. So even though it looks like a bunch of Latin, it sounds like some sort of Harry Potter spell, I mean, that's the great thing about these long muscle names, is that often they tell you a lot of information, and you can make a good educated guess where to look at if you know these root words. So again, our levator anguli oris is going to upturn the angles of our mouth, but the levator labii superioris is going to lift our lips up, and it's located superior to our lips. Whereas the depressor at labii inferioris, hey, that rule of opposites applies in two places here. The opposite of elevation is depression, and the opposite of superior is inferior. So this is why it's good to know those antonyms and those root words. Even if you've never seen these muscles before, or this is the first time you're starting out with muscles, if you have a very good vocabulary, you can make a good stab at where a muscle is just based on its name. And that's one generally useful skill to have when you're first starting out with anatomy, is just knowing the vocabulary, so you can kind of know where to look at first, even if you've never seen it before. Okay, so what we have is direction. So remember that I also have this worksheet uploaded to the resources folder on La Lima. So if you like this system, and some people don't like this kind of way of studying the anatomy, and that's totally fine, but if you're really good at this sort of like vocabulary and root words, this really pays off in spades. So what we have here is that rule of opposites. If there's a levator anguli oris, there must be if there's elevation, there must be depression. If there's a levator labii superioris, remember labii refers to lips. So the opposite of elevation is depression, the opposite of superior is inferior. And that's the great thing. So now let's talk about size. Now size also can lend itself to, or some muscles are named after their regular size or how they're oriented. And what we have is adductor group. Now it's very tough to I think it's better than the OpenStax version. So there are many muscles, and where do you notice? Well, what happens when these muscles contract? They are going to shorten and move this femur closer to the midline. So these are why they are adductors, because they're going to move that legs and lower limbs toward the midline. Now the adductor group, and this is again why there's some debate between how many muscles do we have? Do we consider the adductors as a single group, or do we consider them totally different muscles? So there's an adductor brevis, and brevis is the root word is similar to saying something is brief. It's very short. And adductor longus, so the opposite of short, so it's not adductor shortus, it's adductor brevis and adductor longus. Thankfully, long means the same thing in Latin in general. So brevis and longus, these are opposite terms. So what we have, same adductor brevis and longus, but if there's a brevis, there must be a longus. And there's an adductor magnus. So magnus or major is referring to great or large, and minus and minor. So typically there's an adductor minor, or if there's an adductor magnus, there must be an adductor minor. But in the human body, so this is the other thing too. Sometimes there is implied opposite, but it might not be totally discrete and a separate muscle in humans, because sometimes we share these muscle names with other organisms as well. So there are some exceptions to that rule, but in general, the rule of opposites works. So again, the opposite of short or brief is long. And then you have the adductor magnus, and then you have the adductor minimus, and again, it's considered part of the adductor magnus in humans, but that's more like FYI. So if you're trying to look for a separate adductor minimus, you might have a hard time finding that because in humans it's kind of considered part of the magnus, but in other organisms and animals it might be considered separate. And then what we have is Brevis longus magnus, and then all you have to know is pectineus and gracilis. So the thing is that sometimes the systematic terms don't apply to all muscles, but what we notice is that for the adductor group, if we know our rule of opposites and our joint movements, we can already knock out 3 of the 5. So this is the way I first started studying muscular anatomy, is like one with the anatomy coloring book, but also like knowing the root words, so that if I already know where things are based on the root words, all I have to do, that cuts my work down by a lot. And all I have to know is, okay, this is the pectineus and this is the gracilis. And gracilis, I love that one because gracile is like a nice way of saying something is skinny or slender, and this is what we have here, a very skinny and slender muscle that helps with adduction. Now longus, so here we have many other muscles that have longus in the name. So here we have longus capitis, and capitis referring to the head, and longus colli, and notice that this is on the neck. Where is the collar of your shirt? Around your neck, right? So this is why these root words are very useful. And then you have something called a longisimus, and this is, so what we have are the several muscles, and again, there are individual muscles, but this time we're referring to them as a group. Now, do I want you to know these individual muscles? Again, not so much at this level. If your lab TA is going over these, then yes, you do have to know for your lab. But this is another reason why we have like how many muscles are there in the body. Do you consider all of these individual muscles one muscle, or do you refer to them as a group? But back to my original point, what's the difference between longus and longisimus? Well, I like to think of it this way. So longisimus means longest. And if you've ever seen, I've never been to the opera, but if you've seen like how people have the opera on TV, they're like, bravo, bravo, bravissimo. So whenever it's the isimus or isimus something like that, they're saying like it's something extra. So they're saying not just bravo, but extra bravo. Same with longus and longisimus. It's like saying it's the longest. And yes, Italian derives from Latin, so that's why it sounds very similar. So longest is long, but longisimus is extra long. It's the longest. And notice that it's even longer. The word itself is longer than long. So whenever it says to see that isimus or isimo, that means extra, extra, extra. Like forte and fortissimo. Yeah, so that's like, it's saying like it's even more so of the original. And here we have the tensor fascia latae, or TFL is a common abbreviation. So lata referring to so lata also means like same thing as lateral, but it can also mean wide. So lata is Latin for wide. And what do we have over here? We have our Latissimus Dorsi. So this is the right side over here, so our lats. Notice that if we had our lats intact, it would span all this way. So we have this lata, we have this kind of like very wide muscle over here, but over here we have this latissimus. So it's saying it's the longest or the widest. So it's not just wide, it's widest. So dorsum refers to back, as we know, and lata means wide, so latissimus is widest. So just like longus versus longisimus, lata and latissimus means the widest. So this is what we're talking about our lats. And yeah, look at this guy right here. Super wide. Look at that wingspan. So this is the widest. So think that latissimus is widest. So the Latissimus Dorsi, that's the longest or the widest muscle in the body. Okay, so great thing is that size. So it's not just about, sometimes they say it's, oh, this muscle is long, or sometimes they say it's extra long. It's the longest. Sometimes they say it's like not only wide, but they say it's also the widest. So lata, latae, and latissimus, or another way to think of it. I've been saying these words wrong the whole time. I say words wrong sometimes, and so it depends. Like, you know how whenever we say some foreign language words in English, we kind of like sometimes change the pronunciation. And do you have to say it like the original Italian or Latin? Just go with there's multiple pronunciations. I'm not a stickler. Some disciplines are more judgy than others in terms of like judging pronunciation. I'm more about whether you can recognize these words. But yeah, if you're going to orthopedics, go with like if whoever's precepting you or whoever you're shadowing says it a different way, copy them. So try to blend in. Yeah, but again, this is like, even if they pronounce it different between English and the original language, the meaning is the same. So that's what I'm getting at here. So again, this is like, if you've been taking your nomenclature and landmarks and movements and all this vocab seriously, you know a lot of these terms. It's just the extra ones you have to add that helps to fill out your knowledge of the muscular system. And look, just like based on those just root words, we already knocked out quite a bit. And let's see, do I have something? What's the next question? Oh, we don't have the next question. Okay, so before this, so what we have is that, don't worry about top hat for that one. I actually, maybe that was different from last year. Okay, rewind. So what we're able to see is like we're able to cover a lot of these based on like the action, the head, the shape, the locations, the size, the role of opposites. So just by knowing these root words, you already know a lot. And these are the ones we know. And hey, in this view right here, all we have to our left are some things like the procerus over here, like right here between your brows, and the platysma over here. So again, by knowing these root words, you're able to get a head start on things, without even looking at these muscles. But you still have to visually identify these muscles as well. It just kind of gives you instead of just looking in random places, you kind of know where to generally look. Okay, so, and then let's cover muscles of mastication. So mastication, just a fancy term for chewing. Yeah. If the muscles has multiple names, will the exam say one or both of them? I mean, if they have multiple names, like if there's a totally different name, it might say that, but you should go with the names that we see here in both textbooks. So like, I won't go with a super rare name. Like if there's a super rare name for a muscle somewhere, don't worry about that for this class. But yeah, focus on use the nomenclature we use in the OpenStax and the Martini images. Like epicranius, oh yeah, so that one, yeah, occipital frontalis. I kind of made it get known, so if I really point out that there's alternate names for that, you should know both, because yeah, especially occipital frontalis, it doesn't quite, I mean, it's different from epicranius. It kind of refers to like, are we talking about the bones, or are we talking about the relative like position compared to the skull? I think you should know both because different books use different terms. Yeah, for that one, definitely you should know both. Alright, so muscles of chewing. So what we have are four main muscles of chewing. We have the temporalis, which is deep to the temporal parietalis, and the masseter. So you can feel your masseter. Again, look, it's going to connect to the zygomatic arch, but it's not your zygomaticus, that major and minor, that would be over here. But the masseter is this big muscle over here, and other animals, like especially animals that have strong jaws and chewing, they're going to have very powerful masseters. And hopefully we can have labs we're planning labs in person next year, or next semester, so that if you're taking the 142 lab, if we have fetal pigs, you can see that they have very prominent masseter muscles. And over here we have the lateral and medial pterygoid. And pterygoid, that might sound familiar. So pterygoid muscles, they attach to the pterygoid processes. And this is my mnemonic. I like to think of it like, remember, what bone is the winged bone? And what bone has a greater wings and lesser wings? The sphenoid bone, right? So you have these processes that poke out. Remember, processes poke out, they poke out and protrude. And you have these pterygoid muscles that attach to these pterygoid processes. Yep, so this is the sphenoid bone. And hey, there's a lateral and medial plate, and we also have lateral and medial pterygoid muscles. So I like to think of it that way. The pterygoid process are like the little feet of this winged pterodactyl, and they're going to hold on to the pterygoid muscles. So we have our masseter, temporalis, our lateral pterygoid, and again the role of opposites as well. The opposite direction of lateral is medial toward the midline, right? So if there's a lateral pterygoid, there must be the medial pterygoids as well. Okay, and now let's go to another region of the body. So I'm going to just go over muscle groups in general. And we did talk about oblique and rectus muscles, and this is one way to look at it. So again, we think of our abdominals, or I'm working out my abdominals. Everyone thinks about the six-pack, but you notice that it's not just about the rectus abdominis and all the tendinous inscriptions that make someone have a six-pack, eight-pack, or 10-pack. It's also about the obliques, and there's multiple layers of the obliques, and there's also the transversus abdominis. And if you actually cut through this, and here we have a transverse section, and you notice that the rectus abdominis, even though it's the front and the very prominent part for someone who's like super lean and ripped and does a lot of crunches, I mean, this is the part everyone knows, but notice that on the sides, on the lateral, we have multiple layers. We have the external obliques, the internal obliques right underneath the deep to the external obliques, and the transversus abdominis. So it's kind of like your own. And in the back, in the posterior of here, we have the quadratus lumborum. And so what we have is like layers and layers of muscles, not just the rectus abdominis, but we also have it on the side and lateral. And they're oriented, and back to the previous lecture, the obliques are kind of oriented versus the rectus abdominis, which is kind of straight up and down. The obliques are kind of oriented at angles, and the transversus abdominis is along the horizontal plane. Alright, so let's do a little review. And this is another major thing you should know as well. So with the superficial versus deep dissections, like, am I going to ask you to identify like something very, very small, like over here? Probably not. Because again, it's like it has to show up pretty visible in the exam. But things like this, superficial muscles are very easy to determine. You should definitely know those as well. For axial muscles and appendicular muscles, I mean, if I do test you on these, will I just say like, okay, this is a cut muscle, I expect you to identify it. If possible, if there is, I'll try to go with the intact muscle. Because again, you might be like, wait, what muscle is this? Okay, what did it look like originally? I will give you probably the whole Pec Major versus a cut Pec Major, or like for the this other Pec Major over here that's cut. Again, I will give you the whole one, not the dissection. But sometimes it'll say like cut and reflected, so that you know you're looking at a deep dissection. So yeah, this is another good image to study as well. Transverse section of a muscle. Yeah, you should know the view of the diaphragm as well, because you kind of get to see how it's oriented with the tendon. Now, all muscles, unless there's a transverse view of that muscle in the book and in the study images I uploaded, you don't have to like search out for your own transverse view of that muscle. So again, I'm using these ones that are pretty well defined. Okay, all right, so next question. And let's go to top hat. Start question. Wait. Whoa. Something kind of went funky there. Okay, let's open this question. Sorry, a little hookup and top hat over here. Functions and movement of each muscle. So if I test you on the movement of the muscle, I'll ask you about like if it has it in this name, definitely for sure. But in terms of like the movement of a muscle, I will either have a muscle that has the movement in this name, or a muscle, I'll tell you the origins and insertions, I have to predict how it will move. Or I can have a picture like those adductor groups. Just by looking at the picture, you know how how those muscles are attached to the pelvis and the femur. You notice that's on the inside of the pelvis and the femur, right? So it's obvious that they're adductors because they're going to shorten. So that's another way I can test. I'll show you a picture of a muscle, and based on where it's attached to, can you predict what it will do to that joint? So, not muscle anatomy, like in terms of like 50% of the exam will be will be in terms of like anatomy in general. So it's just like not just muscles, but also skeletal anatomy as well. So again, it's not just muscles. We also have to cover the bones as well. Origin and insertion. So again, for the lab, yes, if your TA covered origins and insertions, that's fair game for the lab. For this class, I'm not asking you to memorize origins and insertions for the lecture class. Now, but you should definitely be able to know what an origin and insertion is and which pulls toward which when a muscle contracts. And yeah, so it's not 50% is muscle anatomy, 50% is general anatomy. So for skeleton and muscles, so at least 50%. Not all, but it's a big chunk. So if you don't know your anatomy, then you will have a very hard time passing this exam. But again, if you're taking it seriously, then you should be pretty well. And also use the homework. The homework's there to help you to practice your anatomy as well. Alright, so yellow square highlighting the Pec Major, and I'm glad most of you hit this part. So again, pectoral refers to, so the Pec Major, this is the one you see if you go to the gym. This is what everyone who's doing all the bench pressing is trying to work out. The Pec Major is this big muscle over here. So this big, again, we have our convergent muscles and the ones that spread out like a fan, all the fascicles over here. So what's going to happen when this contracts is going to bring the shoulders toward the midline. So this is why when people do pec flies, they start out here and they're trying to contract their pecs as they bring their arms toward the midline. Next question. Okay, so let's see if you can identify the external obliques. Oh, what's happened there? And that's another like so when I show cuts, I'll probably show them like this. Like I'm saying something's cut, so it's showing a layer underneath. So I'll show you the border of where something is cut. Alright, so external obliques. So what we have here is an intact muscle on the left over here, and what we have is like a cut here and another layer. So it seems to be a debate between these two. So the correct one is the external obliques. Again, they're going to be outer, right? They're more exterior. This is showing the internal obliques, and this is the rectus abdominis. And here's the serratus anterior. So yes, this is the external oblique. So it's at an angle, but it's external because this part right here is right underneath that cut external obliques, and this rectus sheath over here. Okay, next one. Now that we know our external obliques, where are our internal obliques? Internal obliques, come on, come through. Okay, now it's working. Internal obliques. Or another thing with origin and insertion, like again, if I mention origins, insertions, and actions, like can you determine action if I give you an origin insertion? Like say there's a muscle that originates on the coracoid process of the scapula and the supraglenoid tubercle of the scapula and inserts into the radial tuberosity of the radius. So it starts at the scapula and inserts on the radius. Can you determine what this muscle contracts, how it'll pull? It'll pull the radius toward the scapula. Maybe it's going to flex my arm at the elbow joint. Hey, and I actually just described the biceps brachii. So I will give you the origins and insertions, but I might ask you, can you predict how it will act? Okay, back to our question. So now that we have our external obliques, now for our internal obliques, and our internal obliques are this one over here. So again, This is our rectus abdominis. So abdominis is going straight up and down. Our obliques are at an angle to the axis of our body. So this is the internal obliques because it's internal to the external obliques. If you time out on the exam, so this is our thing about the time, your time limit. Once you run out of time on your exam automatically submits. So make sure you're paced so that you're able to keep up with the exam. Like you want to be done with, like, say, you want to be done with at the 25-minute mark, and there should be a clock that appears at the top of if you're taking the top hat version, there's usually a clock that appears in the very top. Try out. Oh yeah, also there's the the test drive exam, so try that out to make sure you're able to see that your clock actually works on the top hat exam, so that you're able to keep on pace. Because again, once you run out of that 50 minutes, it automatically submits. Same with the Laulima exam. The Laulima exam, if you're taking it at a UH test center, it also has a timer, and when that timer runs out, it also automatically submits. Yeah, so if a timer disappears, and yes, if you're using Top Hat, it's going to be the same software. So you might want to look at that. And if you're, timer disappear on the first exam too. Okay, so if that happens, talk to the Top Hat chat. And yeah, if the clock was only shown at the very top, if I want to look again, you have to look at the very. So another way you are able to, go to the top of your exam, is that you know the little, it would appear on the left side of your screen, the little bar. You can click that top and they'll scroll you to whichever question on the exam for that. But yeah, I should message the Top Hat about that as well. Okay, so rectus abdominis, let's see what people said. And yes, most people got this correct. So notice that the rectus abdominis is, again, rectus abdominis straight along the axis of the body, and it is below this rectus sheath over here. Internet at the dorms is spotty this week. Any recommendations? I mean, you can talk to UHIT, and I think if you can try to also find a Carol at the library, because I think the library tends to have pretty stable and fast internet overall. So yeah, you can try out different spots on campus this week and test out the internet speeds, and just look up like internet speed test, and you should be able to like find out like where things are pretty. But yeah, library is pretty stable. Actually, both libraries are. Was Sinclair still open? Yeah. Okay, and to wrap up the abdominal muscles, let's try this. Start question. Ooh. Okay, can you do this real quick? So the examples, well, they have the yellow boxes. No, this is something unique to the live questions. Like the click on target, you won't have those on the exam. It'll all be multiple choice, but I'm trying to get you like think in a different way rather than just saying, okay, process of elimination. Can you zoom in on that muscle that's being mentioned? Alright, let's see what the most common response was. This is the most popular order, and it is incorrect. Yeah, so why? So the thing is that even though this image is, now this is where it's a little confusing in the Martini one. Notice that the external obliques, the internal obliques are actually immediately deep, and then the innermost and deepest is the transversus abdominis. So externals, then the internals, then the transverse. So anatomical questions, most of them will have some sort of picture. So again, for anatomy, go with the images, and this is why I also have the disclaimer in the in the quizzes that don't study the anatomy just from text. You have to actually work with pictures, because like when anatomy is inherently visual, and when you're examining a patient and you only know about this anatomy with just word descriptions, good luck treating that patient's condition. So you need to know visual anatomy as well. Okay, all right, so let's go. So another thing is appendicular, or just here we have the posterior muscles, and again we did cover a lot of these, like the traps, the deltoids, the latissimus dorsi, and these over here, again, the very small ones, like am I going to just point out to like ask you to determine the internal obliques from this angle? Probably not, because it's very like you can only see a small sliver of it compared to the overall structure of the muscle. So again, go for the big ones in these pictures. Now let's talk about muscles that move the arm. So one group of muscles I constantly mention, and I also highlight in the study guide, are your rotator cuff muscles. And this is what it's trying to say over here. And this is where it's kind of like annoying with the Martini book. Like it's almost implying that these are rotator cuff muscles. They're not. The coracobrachialis and teres major are not rotator cuff muscles. They help move the arm, but they're not rotator cuff muscles. I think that's why they put this asterisk here, but the rotator cuff muscles, again, this is why we have that mnemonic SITS, this subscapularis, and we also have the supraspinatus, infraspinatus, and teres minor. Okay, so let's go over here. So here we have, so we saw one of the rotator cuff muscles, and what you had to do is actually take these muscles, this bones over here, and other pec major. You actually have to remove quite a bit of tissues before you actually see the subscapularis. So that's why you have all these ribs cut in this image. So the subscapularis is on the anterior of the scapula. Now it's not exposed. You can work it out as much as you can, but are you going to see your subscapularis poking through your skin and like it's like a bodybuilder muscle? No, it's very deep. So you should definitely know that it's there, but it's on the anterior of your scapula. It's not on the posterior. And if we look at our posterior and remove some of the superficial muscles, bones, and structures here, now we have we can see the supraspinatus and infraspinatus again. Just like our superior and inferior are a role of opposites. The supraspinatus is above the spine of the scapula. The infraspinatus is below the spine of the scapula. And then the teres minor is also one that's part of the rotator cuff, because it knows that it's inserting right here on the head of the humerus. Now the teres major, common misconception, people thinking that the teres major is part of the rotator cuff. It helps with the stability and movement of the cuff, but it's not actually part of the rotator cuff. Okay, so top hat question. Let's see, maybe just forward past this part. Okay, so rotator cuff muscles, again, the supraspinous fossa, the infraspinous fossa, and this is why some of these landmarks are important, because they actually give their name to the muscles, just like our supraspinatus and infraspinatus. Our subscapular fossa in the anterior of the scapula, this is where we have our subscapularis. And then the lateral border, and again, this is the big exception, is there's no lateral bordoralis. It's the teres minor that attaches to here. Okay, so, and this is why I also, for the mnemonic right here, this is whenever I write out this mnemonic, I use a lowercase t because it's saying teres minor, not teres major. And here we have and this is why these are rotator cuff muscles. So here we have a subscapularis, and notice that it's attaching to the head of the humerus over here. So this is, again, the humerus inserting on the scapula, and it's helping to stabilize that shoulder joint by keeping the head of the humerus articulated with the scapula. And then in the back, we have the supraspinatus, and it's attaching to the head of the humerus over here. The infraspinatus is going to attach to the head of the humerus here. And we have again, no lateral bordoralis, that's the teres minor, that attaches to the head of the humerus over here. Now, why isn't the teres major part of the rotator cuff? Well, the teres major is here. It's nestled between this teres minor and infraspinatus, but if you actually look at where it attaches on the humerus, it actually attaches not to the head of the humerus, but just below that and a little more distal toward the shaft of the humerus. So this is why it does move the arm, but it does not attach to the head of the humerus like all the rest of the rotator cuff muscles. So that's why it's not the teres major is not a rotator cuff muscle. And the deltoid, also a common misconception that this is a part of the sits muscle. It wraps around the whole thing, so it would be over here, but it doesn't insert on that head, just like, so it actually inserts on that deltoid tuberosity. So that's why the deltoid is also not a rotator cuff muscle. Okay, so quick top hat question. What time does the exam open and close? Again, the exam time you should definitely reserve 1:30 to 2:20, our normal class time. It will open around 15 minutes earlier, but again, so that you can get, in case you do encounter tech problems, you have a little buffer time to solve it. But once you start the exam, you only have 50 minutes. So even if you start ahead in that lead up time, your exam is timed from when you start the exam. So even if you start at like 1:20, you will only have until 2:10, because that's 50 minutes from 1:20. So it doesn't matter when you start it, you have a 50-minute time limit. Yeah, so we have a new question. Now let's give it a little extra time. Okay, so the responses, let's go down the list. So most of you said infraspinatus, most of you said subscapularis, most of you said supraspinatus, most of you said teres minor. So the people, these, yes, are correct. The others are not correct because, again, deltoid and teres major do not articulate with or do not insert onto the head of the humerus. They insert onto the humerus, but in different locations. They do work with the rotator cuff, but they don't share that same common insertion. And let's see, and rotator cuff muscles. We already did that one. Okay, let's just wrap this up here. Okay, so let's go back to our presentation. So flexors and extensors, again, we covered this. This is where the role of opposites occurs. So what if I didn't show you this, or like say it's flexion? Well, if I say, what would be the action of this muscle over here? Well, notice that's going to, when it contracts, it's going to bring that bone right here, this radius, up closer toward the scapula over here. So it's going to flex the joint, right? Because it's going to decrease the angle and bring this forearm more anterior. So this is what I would expect in terms of like origins and insertions questions. Like if I tell you which is the origin and insertion, can you predict the movement? And let's see. And yeah, so what we notice is that a lot of the muscles that are in the anterior of the forearm, these are ones that are going to help with the flexing of the arm. So here we have the anterior of the arm. And what do we notice in the anterior of the arm, especially at the forearm? We have a lot of flexors. Why? Because when these contract, what are they going to do? Well, notice that they insert over here. So when they flex, they're going to bring the hand closer to the forearm, right? So this is why they're flexors, because they're decreasing the angle between your hand and wrist and the forearm. So what we notice in the back is that we have not a lot, well, you can see part of the flexors, but we have more extensors. And why is that? Well, again, these are on the opposite side of surface of the arm. So instead of being anterior, now we're on the posterior. So if we have more of our flexors toward the anterior of the arm, we're going to have more of the extensors on the posterior to undo that movement. So this is another way why it's also important to know your directions and movements, because if you know where the flexors are, you kind of know where the extensors are for that same part of the body. And gluteal, so gluteal we didn't get to cover it, but again, so there's more, we talk about working our glutes, so it's actually glutes plural, and here we have a view of multiple. So we have our gluteus maximus, maximus meaning biggest, and then our minimus meaning the smallest, and there's a gluteus medius. So, in order to see the gluteus minimus, you actually have to cut the gluteus maximus and medius away. So this is more deep and smaller, but these are your glutes group. And let's see, thigh, let's see, so internal sternus, and notice where the lateral rotator groups are. So notice that compared to the adductor groups, the lateral rotator groups are more on the outside, so they're not going to really focus on, they're going to pull and rotate toward the outside versus pulling toward the inside. And then iliopsoas. And yeah, so I think rather than running out of time, I'm going to end it over here. And one more question, will we be able to see our exams, night of the exam, like with exam 1? I believe so. I think when everyone takes the exam, unless there's a makeup exam, I think when it's assigned, the way Top Hat, I think the last time, unless something changed in the software, once everyone's done, if there's someone still taking it, scores aren't available. But once everyone's done, then it becomes available. Alright, so the rest of the muscles, we covered most of the muscles. We covered, tried to cover as much of the trunk muscles as we could. And some of the upper limb and lower limb, I think this is what you kind of have to study on your own. Maybe I'll have some bonus questions during the review session for this. So, but again, this is where we were able to kind of, if you like the vocabulary, by all means use it. It's a good way to get a head start on things. If you like drawing, like the anatomy coloring book, and if you haven't opened it at this point, that's kind of tough. Maybe save it for your future classes. But again, if you like your visual, go with visual. If you like root words, go with root words. But for anatomy, especially skeletal and muscular anatomy, you should definitely go with the images and use the ones that are uploaded to Laulima as basis. Alright, so see everyone on Wednesday, and again, study guide, and I'll put another announcement as well on Laulima later on today, alright? So see you on Wednesday. Wednesday, no new material, it's just the review session FAQ on Top Hat. Alright, thanks to our moderators, and see you all on Wednesday.